Hello everyone, hope everyone's all good. Today's lecture is gonna be about the neck. Okay, this purple section here. I'm just gonna briefly describe the anatomy of it and the most common conditions that I see. I'm gonna try to keep everything short and sweet because I can go on for hours. So just quickly, some of the signs and symptoms that can be going on with the neck is neck pain. You can have muscle spasms. You can have really bad headaches. You can have reduced range of movement, so you can't look over your shoulder, you can't look up at the ceiling. Looking down is painful, you don't want to do that. You may also have neurological signs and symptoms. So for example, when I go on to talk about the disc, if a disc is pressing the nerve root, you can have neurological symptoms, which is pins and needles, shooting, burning pain down into the hand, into the arm, into the fingers. Okay, cool. So the neck is made up of 7 vertebrae. Okay, and in between each vertebra, I don't know if you can see, we have these discs. These discs are for cushion purposes to help support the neck, because then what sits on top of the neck is a big heavy skull. Okay, outside these yellow bits, we call these nerve roots. These nerve roots supply our arms and legs and our body with signals for muscle contractions, etc. Within the spinal column sits the spinal cord, and that is the basis and the main thing that makes up the CNS. So here in the lumbar spine, where it's most common, you get a disc bulge, this little red thing here, which you can see is pressing on the nerve. We can get the exact same thing that happens up here, where the disc can protrude backwards and press on the nerve root. If it presses on the nerve root, you would have pins and needles, numbness, tingling, shooting pain down to your hands, down to your fingers. You may have some weakness in your grip, for example, you may lose some strength, and overall some loss of sensation, specific hands. If you're able to pinpoint, for example, if it's in the pink or ring finger, or if it's in the middle finger, or if it's in the first 2 digits, it can tell us a lot as to which segment the disc lies. And lastly, we have these facet joints. Okay, facet joints are these structures on the side, these bony structures on the side in which the nerve roots come out of. We can have 2 examples of facet joint issues, where if you're young, athletic, and got hurt in a rugby tackle or went up for a header in football, you could have sprained the ligaments supporting these structures. The other type is if you're in the older category, for example in your 50s, late 50s and onwards, these discs, they become to shrink. These facet joints, they close on one another. So instead of being separate like this, they slowly come and close. And these facet joints, when they become closed, they can again compress the yellow nerve roots that are coming out. So in a similar fashion like a disc.